Hi everyone, my name is Dr. Robin Lewis. I am a naturopathic physician practicing here in Vancouver, British Columbia, Canada. And today I want to talk to you about one of my absolute favorite medicines for the heart. So have you ever looked into different natural remedies and herbal remedies for the heart and gotten overwhelmed? There's a lot of things out there that could be helpful in theory, but aren't actually that useful practically. Today, I'm going to talk to you about one of the most popular and widely used herbs for the heart, and that is hawthorn. Or, if you want to get fancy with Latin, it is referring to the Crataegus species. So this plant has been used in medicine for heart-specific conditions for thousands of years. And more specifically, here in North America, it has been used since the 1800s. Traditionally speaking, it is referred to as a heart tonic, which means it brings well-being and balance to a particular system. So in the case of hawthorn, they're referring to its benefits with the heart and the blood vessels. So today, I want to break it down for you and explain why this is being used and what it is being used for more specifically nowadays. Is it safe? And how you can get the most out of one of our oldest and most impressive herbal medicines for the heart. Now, unlike back then, we have a better understanding of how this plant works. So now we can apply it a little bit more specifically because, of course, it's not going to be helpful for absolutely anything in relation to the cardiovascular system. So how can we use this in a more specific way to maximize its benefits? But before I go into what it's useful for, I want to talk about what makes this plant unique. So this chunk is for anyone who likes to nerd out on the different compounds and parts of the plant that can be used as medicine. There are compounds in all of these different types of herbal medicines that give them their unique claims to fame. A really good example of this is willow bark, which was traditionally used for pain relief. And then when they studied this and investigated further, they found the active compound called salicylic acid. And that is what they have concentrated and put into what we know as aspirin today. And you see this a lot of the time when it comes to herbal medicine. People are curious about why this particular plant is helpful for this particular condition, and they can usually identify specific compounds within that plant that make it useful for that thing. When it comes to hawthorn, there isn't just one compound, but it's many different kinds of compounds. Generally speaking, these many different types fall under the category of flavonoids, which you can kind of think of as just a really unique and strong antioxidant. If we're being more specific, the type of flavonoids that are responsible for the benefits of hawthorn, or at least the ones that we've discovered so far, are rutin, oligomeric proanthocyanidins, epicatechin, vitexin, quercetin, hyperoside, and many other types of flavonoids that are found in the leaf, the berry, and the flower of the hawthorn plant. To give an example of why one of these specific compounds could be helpful for cardiovascular disease, let's look at oligomeric proanthocyanidins. These compounds have been shown to improve the stability and the formation of collagen, and it will help improve the cross-linking between collagen strands, which are a type of protein very important for structural things inside of the body. Now, in regards to heart disease, this is helpful for the integrity of our blood vessel walls. And if you know much about how heart attacks and strokes happen, this will become very, very important. If we're talking about heart attacks and strokes, there's a common misconception that it's a slow buildup of plaque inside of our arteries that will eventually block off that blood vessel completely, thus suffocating the tissue. You won't get oxygen and nutrients to a certain area if you block off the blood supply to that area. In the context of the heart, it's blocking off blood flow to the heart. In the context of a stroke, it's blocking off blood flow to the brain. But 75% of the time, That's not how it works. It's a smaller plaque that has popped, formed a clot, and then it gets lodged somewhere else, thus cutting off the blood supply. So it's actually of benefit to try and stabilize and strengthen those plaques so they are less likely to pop. And how do you do that? You form a stronger meshwork of collagen on top of that plaque. And then, of course, it could help prevent the formation of plaque because the formation of plaque starts with an injury to your blood vessel wall, and then cholesterol and things start flooding the wall, and it forms something like a plaque. So this is actually quite relevant to the health of your blood vessels, which ultimately is what leads to things like heart attack and stroke. So this is just one example of one compound within the hawthorn plant. What's really cool about plant medicines is that there's obviously a ton of different compounds. We haven't isolated things. We're taking the whole plant and maybe making an extract out of it, but there's many different components. So a lot of the other flavonoids are also helping the cardiovascular system through various different angles. So it ends up being a very well-rounded type of medicine because you are helping the various different issues that surround cardiovascular disease. It's never just one process happening at a time. We have inflammation, we have damage, we have cleanup crews that are supposed to be working that might not be working. So the hawthorn plant is really well known for helping nourish the cardiovascular system and help it kind of repair. Now let's talk about more specifically how the entire plant can be used in cardiovascular disease. The first thing that I want to talk about is the use of hawthorn for atherosclerosis, which is essentially the buildup of plaque inside of our arteries. And as I just mentioned, we know that specific compounds can help stabilize the plaque inside of our arteries. But what most people don't realize is that we all have plaque inside of our arteries, just to various degrees. And the development of plaque starts as early as our teenage years. Now, of course, as we age and the more poorly we treat our body, the more plaque will develop. But nonetheless, this is something that we can all relate to because whether or not you feel it, you have plaque inside of your arteries. The other aspect of plaque health, or how dangerous a plaque is, how likely it is to turn into something like a heart attack or stroke, there is also an inflammatory component to this process. And hawthorn, when studied in animal models, has been shown to slow the progression of the plaque through controlling inflammation and cell death inside of that plaque. Because inflammatory plaque is also the type of plaque that's more likely to rupture or pop and form a heart attack or stroke somewhere else down the line. When they looked at the use of hawthorn in menopausal women, they found that the application of this medicine when people are entering menopause will help prevent the damage to the blood vessels that can accrue when someone is going through menopause. What most people don't realize is before menopause, the rates of heart disease in men far outweighs the rate of heart disease in women. But once women hit menopause and their female hormones start to drop, those rates actually get a lot closer to 50-50. And they very much attribute this to the drop in estrogen, which can lead to unhealthy blood vessels. Hawthorn appears to be incredibly helpful for preventing this. So they have studied in animal models and they've studied it in human models to show that it is helpful for preventing the progression and the instability of the plaque inside of your arteries. The second thing that hawthorn can be helpful for is congestive heart failure. Now, this is referring to when your heart has hit the point where it cannot keep up with the demands of the body. So it does not have the capacity to send adequate amounts of blood to your entire body. So of course, this is a more severe progression of heart disease. It usually happens over many decades of damage to the heart or after a more severe event like a heart attack that you have survived. But nonetheless, Because of the nature of this condition and how serious it does limit you on what you're able to use for it because you have to be more cautious with these types of patients. They are in a more fragile state versus someone who just has plaque inside of their arteries. Luckily, Hawthorn is very safe, well tolerated, and has very few drug interactions. When they've studied this in humans with various different stages of heart disease, they have found that the use of Hawthorn can help prevent the deterioration of muscle tissue inside of the heart, prevent sudden cardiac death, and it will help improve the symptoms of heart disease like ankle swelling, shortness of breath, and poor exercise tolerance. And they have found that you can see changes in these markers and changes in these symptoms in about 4 to 6 months of use, which in the grand scheme of things is not a long time. The third thing that I want to mention is much more common and generally speaking happens earlier in the progression of heart disease, and that is hypertension or high blood pressure. Now, Hawthorn is believed to be helpful for a few different reasons. The first one is they believe it helps reduce or inhibit something called arginase. By blocking arginase, you will see an increase in the amount of nitric oxide inside of the blood vessels. And this molecule is responsible for dilating or opening up the blood vessels. And this reduces blood pressure. There's also a small amount of evidence that shows that Hawthorn can be helpful for reducing cortisol, our stress hormone, and thus you see a reduction in blood pressure. And then the last thing is they believe it has a mild ACE inhibitor-like effect. ACE inhibitors are the key component in our medications for blood pressure like Ramipril. And what they do is they improve the opening of blood vessel walls by blocking a specific compound. So it's not surprising that when they studied this in humans with mild hypertension, they found a reduction in their blood pressure. But keep in mind, you do have to be on it for a while in order to notice these impacts. It's not going to reduce your blood pressure in the moment, but they have studied it and found that with daily use, you can see a reduction in your blood pressure as soon as 3 months. Now, I have only highlighted 3 of the key applications for this particular plant. There are other applications that I believe don't have quite the amount of evidence to support, but that doesn't necessarily mean they can't be helpful. It just means they haven't been studied enough. So some of the other uses for Hawthorn are things like arrhythmia, so heart rate disorders. Hawthorn has been used traditionally and currently for a lot of different types of arrhythmias. High cholesterol. Both arrhythmias and the cholesterol research is done mostly in animals, and there's not a ton of human studies, but it's still being shown to reduce cholesterol in animal models at least. And lastly, it can be used for some of the other health conditions that put you at a higher risk of heart disease, like diabetes and fatty liver disease. So there's also a small amount of evidence to suggest that Hawthorn is potentially helpful for those things as well. All right, now that I've covered what it can be useful for, I want to walk you through how to actually use it. Because anytime you're working with any type of herbal medicine, it's very important to know what you're doing. This is important from a safety standpoint, but it's also very important from an efficacy standpoint. Because if you're not taking the right amount of something, or if you're not taking the right form of it, then it's not going to be helpful for you. You need to make sure that you're taking it correctly in order to realize the benefits. And when it comes to plant medicines, they can be used a lot of different ways. If we look at how a lot of these medicines were being prepared traditionally, they could be applied into food, they could be applied into different teas, alcohol extractions like tinctures. Modern day can be put into powder, put into pills, more standardized extracts of pills. So when it comes to Hawthorn, really, what are we looking at? How can we use this and actually realize the benefits on things like hypertension? Luckily, the main active compounds inside of Hawthorn are flavonoids, and they can be extracted quite easily from the plant relative to other types of compounds that are in different plants. So this means that it can be useful in a tincture form, so an alcohol extraction. It can be useful in a tea form, and it can be useful if we're powdering it and putting it into capsules. And in fact, in Europe and Asia, they have created a standardization around this because they actually do use it a lot for things like congestive heart failure. And they've standardized it so there's 1.8% Vitexin, which is one of those key flavonoids. So there's a lot of different ways you can take Hawthorn. And of course, there's a lot of different doses. Now, for things like heart disease, more specifically congestive heart failure or hypertension, you're generally looking at higher doses. For something like atherosclerosis, or if you're using it as a preventative measure, you can get away with lower doses. But either way, generally speaking, higher doses for the more severe conditions, and always paying attention to whether or not it interacts with your drugs. I will say most of the drugs that people are on do not interact with Hawthorn, which is why it's one of the favored products among herbal medicine practitioners, naturopaths, functional medicine docs. And it's also worth noting that it's not always given as an isolated herb. There's a lot of studies to support the use of it alongside some of these other things that you would be using for blood pressure, for example. But it's just something that I want you guys to think about. The good news about Hawthorn is you can take it in many different forms. The only thing I would discourage you from doing is trying to use it in food. The reason for that isn't because I don't think that's cool for like a preventative measure. It's more like you're just not going to get a high enough amount of it in the diet in order to see a reduction in blood pressure, for example. So it just might not be the most effective way of doing it, even though in a lot of these cultures, they are applying Hawthorn as food. All right, the last thing I need to talk about is who should not use Hawthorn. So who's not a good candidate, because this is not used for everybody in the population. There are two main populations that should avoid the use of Hawthorn. The first one is low blood pressure. So because it can lower your blood pressure, if you already have low blood pressure, it's probably not a good combination. The other one is if you have bradycardia, which is a very, very low heart rate. So if your heart rate is already too low, then potentially Hawthorn could further decrease that, which is probably not what you're going for. But otherwise, it does seem to be well tolerated in most. So I hope you found the information today helpful and useful. There's never enough time to cover everything, especially when it comes to herbal medicine. So I tried to keep today very short and concise. These are the areas I think it's the most useful. This is how you can take it, and this is who shouldn't take it. If you guys have any questions or comments, please leave them below. If you want to give me a like and subscribe, that is always helpful to further grow this channel. And otherwise, I hope you guys have a lovely day.